My name is Gabi Portugal, or Gabriela Portugal. I am from Mexico, and I am the Cancer Programs Manager at Alliance Community Services. We have the Cancer Survivors Program out there that we call Triunfadoras. It's a group of Latina survivors that we have from every country of Latin America. We all speak Spanish. And we serve them, this group, as a minority group. They are all cancer survivors and come from different ways of life. We have a group for them where we work through educational resources. We navigate them through the healthcare system. So I am working with them. I was born and raised in Mexico City, and I have studied in the National University out there, where I got my MD degree. I started working for a clinical research organization that is a transnational that was based here in the United States. So I worked for them out there 6 years. And then I migrated to the United States in 2006 with my 2 daughters and my husband. We came here to pursue his career as a transplant surgeon at the University of Florida in Gainesville. So I kept working throughout my stay out there for another 8 years. So when I stopped working for clinical research, I started volunteering for the Hispanic community out there. And so when I moved here to Salt Lake, I found some ways to volunteer through the Mexican Consul. I was invited to talk as organ donation awareness advocate. And then I met people from Alliance Community Services there. And then when I knew about the Triunfadoras group, that's where I was hooked up with them, because it's an amazing group. So I've been working with them, writing grants, and we are putting together mental health programs for them, as well as a genomics program, so that they are aware of their health, the responsibility that they can have in their hands. Because they loved to have someone to talk about not only health and lifestyle, but anything to them, because they need information in their own language that is sensitive in so many other ways, not just the culture, but also the food, the music, and that we can share in so many other ways outside of the tragic diagnosis that they are going through. This year has been a challenge, of course. We have gone virtually, but they all have the hope of coming back together again. And that force moves so many things, So I love volunteering for them, because just learning from them is more valuable for me than probably what they can get from me. It's a big, big win-win. We have worked at the Triunfadoras like building bridges. It's a very interesting way, because not only we support them, but they support more between each other. So some of them have reached out to us to navigate them through the system, but then we found that they were uninsured or they didn't speak the English language. So one of them, for example, was a survivor of colon cancer, and she had liver metastasis. Now, what we did was to send her to one of our peers that work at IMC, and she got her surgery done with less charges, because they have these programs that she didn't know there were. So all these resources that were at her hand and we could help her to reach out to, they were invaluable. Now she's back, she's free of cancer, and it's amazing to see how just getting to know people, to connect to each other, saves lives, That's what we try to do. Considering that the Alliance Community Services mission is focused on elevating the quality of life and the health of our minorities, we try to get them the resources they need to reach out who they need to empower them with the education so that they can forward in their futures. For example, we have the programs that they need in not only for the cancer survivors. We also have participated in the community for COVID relief in this year. We have directed through some help for rent, help for resources for food, and some others that the county has provided. So that workforce, which is kind of new, has grown enormously this year. We have also some other programs for legal assistance. We have programs that are for them to enroll in Medicare, CHIP. We have a program that is for preventative medicine for screening in uterine cancer, cervical-uterine cancer, and breast cancer. So we send them to get their mammographies or pap smear. So as part of our navigation program, we also provide translation and transportation programs for some of the survivors who need them. This is like a whole team that is working little pieces by pieces to make a big effort for our community to have affordable and easy access care for many of their needs. Anyone can qualify for our services. We are serving the Latinx community here in Salt Lake City. However, the group has served, especially the cancer survivors group, have served anyone in Utah, from rural communities, and we have representatives even in St. George, so all the way through the South, especially this year that we changed everything to virtual mode. Anyone can access the support group. We have the programs running in virtual mode through Zoom meetings, and that means that we have survivors who connected from other countries. So they just took the class in Spanish, and we have communication with them through WhatsApp. So we are just opening our resources in this new normal, and it's very accessible to anyone. In Alliance Community Services, all of our services are free of charge, regardless of the ability to pay. We have low-income fees for the immigration processes, but pretty much everything what we do for the cancer survivors and many other services are free of charge. I think this is important to everyone because when you are part of a community and you provide your piece as an immigrant, as a woman, as a minority, as a bridge between the medical field and the survivors, and you can just connect, the resources for people, you form part of a bigger piece. Why is it important for everybody? I think volunteering is the only way to change the world. I think if you want to make a change and you want to see it happen, besides voting and doing anything you want outside, it starts inside. The change comes from within. So I wish everybody knew that that's the force, that's the power that moves the community. So when you have gone through the struggles that someone is going through right now, and you know how it feels and you know how it works, you help them because you were there before, no? So I think that's the change that I want to see. That's why I think it's important. I think what it makes a strong community is to be part of a bigger circle. When you are the little piece that makes someone else's life easier, that kind of comes together because that person is going to have the same change, and it will happen over and over. It's like a chain reaction. A strong community has members from every way of life. And this strong community that we have seen here is not just the reflection of other cultures, but the embracing of what they provide to the culture here. So the richness of the community comes from the members, individually and as collectively. So that's why we think doing culturally sensitive groups where you just not Google translate a pamphlet, but you explain people in their own words, in not only the language, but the lingo, the names that we give to things, and the way you call things in your country, and bring them to the community, and everybody learns about that. I think that's really nice to see, no? We have created a group of Hispanic healthcare providers. We are working with the Mexican consulate to create like a task force where we want to guide the Hispanic community needs in the healthcare area and provide them with education. They have their own Ventanilla de Salud, which is their own community health workers directing preventative care stuff. So we are working with them to help guide these the needs in case there's patients that need to be navigated through the system. We have had some of them who have been referred to some of those physicians, and they have gotten the medical needs that they get in a low income, in a low cost scenario. In Alliance Community Services, we have been working with the county as well as the Department of Health for the COVID programs. We are encouraging everybody to wear their masks. We are distributing the devices, the thermometers. We are distributing face masks. We are providing information about COVID resources to the community. And in the near future, we hope we can just help again with rent and the groceries for people who are getting sick. There are so many programs that are being put together. So we are very, very interested in all the community to understand that all the efforts are being put for this to go away. So we want everybody to use their masks, to wash their hands, to keep social distance, and to get educated, because that's the most important prevention. Our contact information in Alliance Community Services is in the website, which is alliance-community.org, and the phone number is 801-265-1111. We have all of our social media listed in the website, and we are posting every week all the resources that we can provide to our community, updates. All the information comes through Instagram, Facebook, and we have a lot of good things being shared. En Alliance Community Services estamos proporcionando información educativa a los sobrevivientes de cáncer, pero también brindamos otro apoyo para las personas que requieren apoyos en inmigración, en enrolamiento de Medicare, en CHIP, en educación de seguridad en el trabajo y ayuda de COVID. Tenemos programas para screening de cáncer de seno y cáncer cervicouterino. Y nuestra forma de contacto está en el website, que es alliance-community.org, y el teléfono es 801-265-1111. Todas nuestras redes sociales tienen información que viene todos los días con updates para todos y son de mucho valor. Como parte de nuestros servicios de navegación, nuestras promotoras de salud pueden proveer servicios de traducción al inglés y al español, y también dan transportación para las pacientes que lo necesitan. Los servicios que proporcionamos en Alliance Community Services son gratis, son libres de cargo para las personas que así lo requieren, y en los servicios de inmigración se dan los costos más bajos para las personas que tienen bajos recursos. Entonces tenemos esto disponible durante todo el año y estamos todo el tiempo para los que nos requieran.